This is a kit of each space maintainer, and the band form is a universal form. The sizes are from 24 till 42. 24 till 29 are used for banding of first primary molar, 30 to 35 for second primary molars, 36 to 42 for your young permanent molars. Along with this, there are three components: the plain loop, curved loop, and distal shoe. There are two accessories, E-cutter and E-crimper. You will also use a straight probe, a band pusher, a band adapter. The first step in doing a preform band and loop space maintainer is to do the banding. The band form is universal. You can use a band adapter and a band pusher to adapt the band and to seat the band interproximally. Being universal, you can squeeze the band buccolingually to make it more rectangular form, and if you squeeze the band in the proximal areas, it will become a square form which can be used for your maxillary molars. Next step is to measure the mesiodistal space. Generally, to compensate for the thickness of the band and the base of the tube, you deduct 3 mm from the total mesiodistal extraction space. Then you measure this space and mark it on the wire component, and in the next step you use a precise E-cutter to cut this on the wire component. The E-cutter will help you to cut the wire at a 90-degree and with great precision without any blur around the wire. Then you check the wire inside the tube. Both the arms of the wire should be parallel to each other and they should be cut at the same level. Next step is to crimp the tube with the wire inside, first inside the patient's mouth. So you stabilize this position inside the patient's mouth. And then you crimp it extraorally. You do a 360-degree crimping on all the sides of the tube. And you check the joint by pulling the wire outside the tube. Last step is to cement the band. The curved loop should be above the contact point of the canine. The first step in doing a distal shoe space maintainer is to band the tooth. Here you can see we compress the universal band buccolingually to make it more rectangular in shape. Then you use a band adapter to adapt the band. You can even use a band pusher to seat the band interproximally. After banding is complete, you measure the mesiodistal width of the extraction space. Then you deduct 3 mm from it and you mark it on the distal shoe wire component. That marking you will cut using a E-cutter, that is a precise cutter which will help you to cut the wire at a 90-degree. You put that wire inside the tube. Both the ends should be cut at same level and both the arms should be parallel to each other. Next step is to crimp the tube with the wire inside, first inside the patient's mouth, such that you stabilize this position. Then you do the final crimping extraorally, 360-degree on all the sides of the tube. The crimping should be either at the open end or in the center of the tube. You check if the wire component is coming out of the tube or not after you complete the crimping on both the tubes. So this is how you check. Then the last step is to cement the distal shoe space maintainer.